I believe Councillor Wheat is going to be a few minutes late. I don't believe Councillor Chambers is going to make it tonight. And Councillor Carty is also away this evening. Can I have a motion to approve the agenda, please? Moved by Councillor Simon, seconded by Mayor Eddy. All in favor? Carried. And that includes our addendum. Are there any declarations of pecuniary interest? If not, please declare at the time. Delegations, petitions, and presentations. Our first delegation this evening is Christina Racic and Lacey De Silva, and they're going to present the Brant Drug Strategy and Public Health. So if you'd like to come forward, ladies. Welcome.
Okay. Thank you. Thanks for having us today.
Welcome, and proceed whenever you're ready.
Sure. So my name's Lacey. I'm the Drug Strategy Coordinator. Hi. And this is Christina.
Hi. I'm the Director of Health Promotion for the Brant County Health Unit.
So we do have 2 print copies on hand today. And it's my understanding we'll be printing some more, and that you'd had some electronic copy go out. So I don't know if anyone would like those, but we'll set them there, I guess. Okay. So this is just an introduction to the drug strategy, its development, some of the core recommendations, and next steps. That's where we'll be heading today, and with some information on the harm reduction piece from public health. Okay, so this strategy was developed in early 2017. There were a number of consultations that were held to ensure that that information was representative. So over 200. And it included youth, service providers, peers, individuals with lived experience. So just to further break down, 50 youth from 11 to 25 and 40 individuals with lived experience. And so just a list of some of the members across the community that were involved. So there were a number of like local service providers, as well as the county and various representations. So we have, of course, the health unit, the Brant County Haldimand Norfolk District School Board, as well as the County of Brant, and there's a number of others as well. So this quote here kind of really sums up the big theme of the strategy, and it's a quote from Dr. Malcolm Locke, and it says, "Addressing drug use requires a multifaceted communal approach and mobilizing all civic partners, and which incorporates the strengths and many varied existing skills found within our community." So it's just emphasizing that we need everybody on board, that this is a big undertaking, and so it will require all of us. So this is just a little bit about the framework. So there is a Ontario Municipal Drug Strategy Network. So there are 30 communities across Ontario that have taken on this framework, which is the 4 pillars. And it originates from Vancouver, who adopted the model from Europe. And that model is that 4-pillar model, which focuses on prevention and education. So that's around delaying the onset of substance use and educating, as well as focusing on treatment and recovery, as well as focusing on enforcement and justice, so the criminal justice aspects. How do we engage that population and ensure that they're being connected to services, as well as harm reduction, which is just reducing the harms associated with substance use. So it's a very holistic approach that is engaging a number of players across the spectrum, and that is one of the rationales behind that 4-pillar approach. So jumping ahead of me here. So what were some of the main issues around these consultations? We talked to a lot of different people, and what were some of the themes? So some of the themes were that people in the community are identifying opioids and methamphetamine as the most destructive and problematic substances used locally. Many people reported illegal opioids being misused and sold at street level, as well as being used to supplement incomes. Alcohol was reported as one of the most commonly used substances across all age groups, and a big key aspect to this was that there's a normalization of alcohol. The youth reported that drugs and alcohol are easy to access locally, and some other themes that came out from the consultation is that there is a social dynamic to using. So, substance use is in your social environment. Participants involved indicated that they're more likely to decide to use if they'd grown up around it and it's been in their environment. And there's also some highlighting the impact of couples using together as well. And so just a quote from a focus group participant, alcohol is an issue, but it's overshadowed because alcohol is socially acceptable. So the quotes kind of just pack that extra punch. So another one of the key questions that were asked during the consultations, what do you think is the major reason for substance use, or what's contributing to substance use in our community? Trauma was overwhelmingly identified by almost all participants. And again, a quote that's pretty haunting. It says, "Don't ask about the addiction, just ask about the pain." Other reasons, medicating to manage mental health, as mentioned before, living environment, social environment, early exposure, and social media and glamorization for our youth population was reported as a big reason. Also, a lack of meaningful opportunities in recreation, education, and employment were identified. So jumping a little further into what some of the local data gathered indicated, so 49.7% of Brantford and Brant residents exceed the low-risk drinking guidelines, which you'll see those low-risk guidelines for women is 2 drinks a day or to a maximum of 10 a week, and for men it's 3 a day to a maximum of 15 per week. So that's, there's that. And as well, illicit drug use. So 15.1% of individuals reported using an illicit drug in the last 12 months, and that excluded one-time use of marijuana. So when it comes to marijuana, it's one of the most popular drugs used by both youth and adults. So 53% of the respondents indicated marijuana use. So that's adults ages 18 plus. And youth were more likely to see marijuana as less harmful and tend to view it as natural. Quite a bit of stats there. So obviously most of us have heard about what's going on with opiates around Canada and Ontario, and it's hit a public health crisis. So locally, some data indicates that from January to September of this year, there were 179 EMS responses to an opiate-related emergency. And so that's a monthly average of about 20 visits. And there's some indication that the major age range that's being affected by those calls is the age range of 30 to 39. So about 32% of those 179 incidences include individuals in that age range. And a lot of them were men as well. So there is that as well. So barriers to services. So that we have this issue happening in our community. What's the barriers to getting treatment, getting help, and moving into recovery? And so here are things that people are identifying: lack of services, access to transportation, stigma, just the fact that a lot of services operate 9 to 5, and that weekend after-hours service is missing. So jumping on to, okay, we've collected all this data, and we've consulted with community members, and we've identified some themes. So what are the recommendations? Where do we go? So there were 8 broad goals that came out of this strategy, and you can see a number of them are listed there. So increasing access to youth-led and youth-focused education was one, because one of the stats that emerged was that Brantford has a higher average of young adults using marijuana in comparison to the provincial average. So there was really identified a need for youth-focused services. As well, we talked about in the previous portion of the presentation that the transportation and access to services, and so there is a emphasis on the need for opportunities in rural locations as well. And I'll pass it over to Christina.
Thanks. I'm just going to back up to the goals and recommendations, just because when the youth drug drug strategy from the city was created using early 2017. In August of 2017, the Ministry of Health and Long-Term Care had then also said to the health units that there's an opioid crisis that's going on and we need to address this. One of the elements of addressing it is to enhance a current drug strategy that is actually being created within a community, and so we have come together with the members of the drug strategy and the Brant County Health Unit to enhance and increase the opportunities for the current goals and recommendations that are here. And so very specifically, the goals 1, 2, 4, 5, and 6 are very specific to what our Ministry of Health and Long-Term Care are asking us to do as a health unit to move forward some of these things. So it's proactive and prevention focused. They really want to have us increase, going the other way, increase to overall, so the increase to prevention, education, and surveillance. If we're looking at the surveillance piece, how many people are going to the EMS, and are they same or are they new? And if they're new, then where's that coming from? And really having a good understanding of the data that comes out. Coordinated messaging from all involved stakeholders to provide consistent messaging and information, so we're not getting mixed information. So we also, one of the things that the health unit is working on currently is a communications plan that is to ensure that no matter who you are and whenever you get connected to somebody in the community, they all have the same messaging. There's an increased access to Naloxone for agencies who work with clients and families who are at risk. So Naloxone is currently it's sort of a first aid response for those people who are currently, who might be in an overdose situation. It slows the overdose sort of reaction down. It doesn't stop it completely. So it buys you time. You get about 20 minutes and you can still have to call 911, you still have to go to EMS, but it reduces overall death. And so that, at the end of the day, is what our ministry is looking for, and I'm sure what the community and council would be looking for as well. And so the other thing we're to do is lead and implement a surge capacity and response plan that includes all sectors to respond to changes in status of the community. So if, for example, carfentanil comes to Brantford and we have a surge in overdoses, we have created a plan working with EMS, police, anybody who is St. Leonard's, the city, the health unit, to then do a wraparound for the community to make sure that Naloxone's increased, the information is out there for everybody to be aware, and for any further sort of overdose potential to stop. And finally, at the end of the day, it really is to reduce deaths and morbidity from overdose in the community through ongoing education, awareness, prevention in schools, general community, and community agencies. So then getting back to having a very strong awareness of what's going on and preventing from the early stages. So that's the plan. We're have a subcommittee and a steering committee that have come together to start to work towards this, that have St. Leonard's, the city, the police.
Working on more representation.
And we're working on a variety. Some we've have discussed with some of the school board representatives as well, mental health leads, to try and create, to start with moving forward on these plans and recommendations. So thank you. Are there any questions?
Councillor Simons.
Thank you, Madam Chair. Yes, thank you for your presentation. I have a few questions, if I may ask. This is a very disturbing thing, and we hear it every day, every night of every week. And it's getting worse. And when you said, and I want to make sure I'm correct, when you said Brant County was the highest users of marijuana, is that correct?
Sorry, I was saying it's Brantford and Brant County, so they're included
Was the
together.
highest users of marijuana?
Compared to the provincial average for that age group.
Okay, my question is this. We're going to spend our time and our energy and our funds to do something that should be good for people. Yes. Why is the federal government allowing to promote marijuana come July 19 when we are the highest users of marijuana now that's illegal? That's my first question. My second question is, how many times can a person be brought back with the drug of Naloxone?
Naloxone?
Yeah. How many times can they be brought back to?
To emergency?
Yeah.
There has been, I think there's been, Scott Secord from the emergency room has said that there's been some clients that have come back 3 or 4 times after experiencing an overdose when they've been on naloxone. Naloxone is, so the same person may come back. When we're looking at harm reduction strategy, what we're trying to achieve is to have, is not immediately to say you must stop, because that doesn't tend to work. What works is if you're going to use this, let's use it in the safest way possible. Usually people who are starting to go down the path of cannabis use or marijuana use tend to need to have some kind of self-medication. So where we'd like to get to is treatment centers. Centers where when people identify that they're having difficulty or struggles in school or struggles in their day-to-day work-life balance, that maybe they can go to a center to have broader discussions instead of turning to drug use.
Okay, if I may continue, thank you. Are you taking this program, and I find the program's a lot of words, and every program, of course, in study is a lot of words. I often wonder if it's ever really exercised and put to good use. That's what my concern is. My concern is this. Have you gone into public schools, young ages, and I'm talking ages 9 to 12, 13, because those are the age levels where they learn this. Those are the age levels that a lot of these kids are users, beginning. And have you gone to talk to those people and give them examples? These people need to see what they could turn into if this happens to them. Okay? Words, kids just listen to words and they're gone. Okay, that's an example that I'd like to see what happens, because it's very important that we get these young kids, not at the older teenagers, because they're already molded into their way of thinking. It's very important.
Absolutely.
Have you done that? Or are you going to be doing that?
Yes, absolutely. So there's a big focus on youth in this report, indicating that there is a need for prevention and treatment and harm reduction for that population. So one of the recommendations to that end, to what you've mentioned, is to have a youth-led prevention and substance use education curriculum that could be accessible to teachers and service providers, so almost creating kind of like a standardized educational curriculum for that population. And those that collected the data for this report heard from the youth was that they'd really like to see education come from their own peers, that there is that peer influence. And so that was one of the recommendations from the youth themselves, that, you know what, if you can bring in somebody that's like us, that can send that messaging, that's going to be more effective.
And one more thing that I think that would be very imperative is, it seems to me the parents are seeming to get off lucky anymore. The parents don't just seem to take blame for too much of anything that's happening anymore. And I wonder, are the parents invited to this stuff or forced to come to these listenings and hear what the stats are, understand what they are so they can work with their children? Because there seems to be a huge disconnect between parents and kids now.
Yeah, absolutely. So, so there's a lot of recommendations around education and information exchange in the strategy. And one of them is specifically targeting caregivers and family members of a loved one with an addiction issue. And there's also some focus around family support. So some recommendations that came out, in addition to, yes, we'd like some education on how to talk to our teens and our youth about this, is the recommendation that, let's say you had a family member or a youth who was struggling with an addiction. Those that responded here were saying, you know, it'd be really nice to have parallel treatment for those family members. So that's something that's also been highlighted here.
My last question is, if I may, what is the recovery of the drug addicts? What is the recovery stat, I guess, or percentage?
We don't, that's a
tough one,
a good question. It was actually something that was brought up to us that I am now investigating.
Because it needs to be, we need to know that.
Yeah.
You know, is it high, low? What is the percentage?
Councillor Boomla.
Thank you.
Thank you, Madam Chair. In answer to that question, I think if you look at some of the data that's coming out of countries like Portugal, it appears that taking this kind of an approach can be much, much more successful than our traditional putting people in jail, putting them into treatment instead. And so I have to commend you for your work. I just think it's really, really good. I guess from this perspective at this table, I'm most interested in, because I know people who need treatment are already waiting a very long time for that. So this drug strategy proposes to do a much, much more effective job of treating people as opposed to just incarcerating them. And I'm hoping we go after the people who are distributing much more viciously as far as that goes. So how many spots do we need in the County of Brant, City of Brantford? But how many do we have and how many do we need in order to actually make this viable? So that if we have 50, do we need 200? You know, I see recommendation number 5, establish a withdrawal management and residential treatment center in Brantford. What does that look like? So this is, I think, a really good big picture thing, but will you be coming back with real numbers as far as, okay, so if we want to follow down this path, if this is a great idea, and I do believe it is, what's it actually going to cost? And what kind of provincial funding can we get, and how much can we expect to be asked for to establish this type of a treatment regimen as opposed to an incarceration regimen in order to get people back on their feet? And I'm not going to ask if we can force people into anything because we're not lawyers, but if we take this approach, my question would be is how many more spots do we need, and about what does it cost per spot per year, if you have any of that information for a treatment program, and what we'll be looking at to get what we need in order to move forward. Thank you.
Do you want to go right?
I thank you for your question. We do have the Brant Community Health System sitting at the table, and that was one of the asks that we had, because right now detox or any kind of treatment is happening at the hospital, and so we're looking at the data and the information around how often, when, and how many, so that we can see, well, if it's not effective in the hospital, it's not a good space, and so then we can say if we have 50 beds, then would that be enough?
Mayor Eddy?
Thank you. I felt extremely privileged to attend the presentation and announcement of the Brantford drug strategy last week. Really informative. And although we're up here to be somewhat behind many municipalities in the field, the work that's being done is so essential, will mean that we'll gain some ground. And the framework was so meaningful, and the list of goals, etc., is so important, because if we're going to have a future for our youth and our citizens, we really need to get to work on this. It's what's approaching is so scary. What's here is so scary. What's approaching is even scarier. We have got to be cognizant and respond to this. Thank you so much for what you're done and doing. and are going to do. It's really essential.
Thank you.
Anyone else? Councillor Miller?
Thank you, Madam Chair. Through you to the presenters, thank you very much for the information. No OPP, you didn't consult the OPP? Being a county councillor, that would be the first group I'd go to, but that's just me.
OPP,
You tried to? Okay. Second question, do we know how many deaths have been related to the opioid use?
this year? Do you have the?
There's the chart there.
I think I have this. I did a presentation to the
I guess what I'm getting at, is it continuing to rise?
It is continuing to rise. So fentanyl so the change, what used to happen is opioid death for all opioids was pretty consistent across Ontario. And when fentanyl came as a synthetic, it became such a toxic type of opioid that for deaths related to fentanyl use, as the opioid had increased significantly. So the spike, Health Canada had 2,800 in last year, and there's been recent, flipping through my papers because I know I had it.
Should be something they have on the top of their head.
19 suspected overdoses and 7 deaths
So far this year.
so far.
Can you put this?
Hold on.
More
No.
than 19 overdoses. Oh, my God. Oh, there's
Suspected individuals.
tons of them.
This was from till April. I'm sorry, this is data from till April. So I don't actually,
Tons of them.
so it was 12, I'm sorry, it was the 20 per month. Yes. Deaths, I don't have the death rate
That's for Ontario.
currently.
Okay, well, I guess what I'm wondering is this continuing to spike, or are we seeing it level off? But we'll leave that for now. My second question is, can you kind of put this whole thing in context for me? We talked about illicit use of drugs, or even alcohol, improper use of alcohol. I don't know, I think it's always been an issue. Is it getting worse? And my second question is, this whole opioid fentanyl thing, are the drugs becoming more deadly, I guess is what I'm asking. Like, you know what I'm saying? Is the use of illicit drugs increasing or decreasing? Do we know? And when did we start seeing this fentanyl opioid use come in, and is that basically what it's all about at this point?
All excellent questions. It's very multifaceted.
Okay, so in October of 2016, the Ontario government decided to take an initiative. It started in BC, but then it started in BC in 2013, and it has moved to Ontario in 2016. And they had noticed an increase in deaths due to opioid use during that time. And what happens is that the fentanyl, certain areas or certain individuals who have received, who have been taking drugs and they go to jail, say for example, they get incarcerated, their tolerance decreases while they're in jail. Then they come out back onto the street, and the type of drug that they're receiving is no longer the same kind of drug that they had gotten in the past, which then puts them at greater risk for overdose, which is why naloxone is one of those things that if they do end up overdosing, you can call still EMS, and then they get to the emergency room, and we prevent the death that way. Overall death has not increased, however, emergency room visits have significantly.
Exactly.
Thank you for that. And Councillor
Did
Pierce?
that answer some of your question?
No, but we'll leave it for now. Thank you.
Oh, sorry. Oh, do you have the rest of the answers?
No, that was the one that you asked. Is there, can you repeat a question that you're?
Well, like I said, I mean, you're here tonight, you're making a presentation. I'm just trying to put some context about, as far as drug use goes, like, has it gotten worse? When I was your guys' age, I mean, it was crack cocaine seemed to be a big issue, and it was, you know, and today it's opioids, you know, so,
Yeah.
I'm just trying to get some context, you know.
Have data on?
Well, I do have data.
Counselor
data
Pierce.
on data.
Are they going to answer that or no? Okay. Okay. Thanks, Madam Chair. Through you, can we just back up just a little bit more in regards to the question that Councillor Miller asked there about the OPP? You said you tried to involve the OPP. Can we expand on that a little?
Aisha?
Yeah, I can speak to that, sorry. Hi.
Do you want to go up to the?
I'm going to get my stats.
Hello, thank you. I'm Aisha Peterson from the City of Brantford. So I helped with the consultation process of this drug strategy development. So we did reach out to the OPP, and unfortunately, I think just due to time constraints, they weren't able to get back to us. So we're trying to engage them right now in the steering committee process. So involving them kind of to fulfill some of the actions that can then meet some of the recommendations. So they'll be involved. So we tried to reach with the high school resource officer, because that could fit a couple of our kind of goals for interviews. But then I think just from when we were doing it, it didn't work out timeline-wise, but they will be engaged for sure in this process.
Can I ask, Madam Chair, that as you are part of the Police Services Board, that you ensure that that connection is set up?
Certainly, I can mention it at our next meeting, but I would like to add, they are working on this issue, and did anyone from the health unit attend the session at the high school that the OPP held on opioids?
I'm not sure. Oh, and just if I can go back to the point about the OPP. So they were involved with the fentanyl roundtable. So that was kind of another parallel group that was meeting, and that was Brantford, Brant, Six Nations, and the OPP was involved in that. So they were very focused on getting awareness and monitoring of opioids. So we did engage with them that way because we worked really closely with the fentanyl roundtable. And then I'm not sure if was the health unit at the...
I didn't attend myself, but there were representatives from the health unit at the...
Oh, there was somebody?
Yeah, there was representatives.
Great. And I thought that even some students attended that and asked a lot of questions, and certainly our OPP are well aware of this issue and carry naloxone. Yeah. And they are working with the roundtable,
Yes.
with the city on various issues. And our community officer, Constable Johnson, is well aware of the drugs. And I learned some new ones the other day at a meeting that are in the high school that I never heard of before. But they are working on solving those issues. And we had a very interesting kit given to us at a meeting called the Cannabis Talk Kit.
Oh, good, yeah.
And I believe that came from the health unit. So good work on that, because when they legalize it, parents will have a resource that they can use to work with their children.
Yeah.
So I'm glad that you're on top of this. And thank you for the great presentation. And Councillor Powell has a question. I think we'll go around the table and give Councillor Coleman an opportunity if he has anything.
That's great, I thought I had it.
Councillor Powell.
Councillor Miller used the phrase, putting it all into context. I think one of our delegations said 7 people have died from overdose. Now, what we see on the news is EMS goes to a location, 1 or 2 have died because of an overdose, which is very unfortunate. However, impaired driving is on the increase. Just tonight on the news, impaired driver crosses the line and kills an innocent person. Now, in that sense, we have had a real trouble trying to solve impaired driving. But impaired driving does affect a lot of innocent bystanders, unfortunately. And with our resources, can we put X amount of money in both of these programs to solve these two programs?
So I think the prevention piece, and I want to sort of circle back to everything, because when we're looking at, when putting it in context, opioids, because of the type, has created some buzz in the media. Alcohol has been an addictive substance for many, many years. Opium, heroin, any of the addictive substances, tobacco smoke is also considered addictive substance. It's been an issue for as long as we've had these substances. So I don't have the statistics, but I would suggest that the overall use of any one of those substances hasn't necessarily increased over the past 10 years. The current one that is causing the most problems because of the type of substances, opioids, is the acuity of the death rate that comes along with it. However, in terms of alcohol, there's death rates associated with alcohol overdose, there's death rates associated with some cannabis overdose. So all of that in relation to what we're trying to do with the drug strategy is looking at that upstream preventative piece from alcohol use, tobacco use, cannabis use, etc. And it's talking to youth and children around any substance is addictive. It changes your brain, and it causes chemical changes to what's going on inside your head. And that's the thing that we'd like to start with in terms of youth, in terms of our the kids in school. Thanks.
And Councillor Coleman, did you have anything that you wish to ask? All right. One more.
Thank you,
question.
Councillor, Madam Chair. I just wanted to say that the OPP had special sessions that they had publicly and very broadly advertised, and one was at the Sanderson Centre. Many families were at that, attended it, and were able to voice their opinions of what happened with their children or family. They had another one at the community policing that was very well attended and very widely advertised. They also had another one at the Paris High School that was very well advertised and very well attended too. So they are out there very much working with this product. But I think you guys do need to get on board, and you need to make a supported effort to work together, and because it is a big problem.
We
So
did co-organize the event at Sanderson Centre with the OPP.
that was a great session. It was a great session. Absolutely powerful. Yeah.
Yeah, and some of those families, we've been able to connect with those families because a lot of people came forward with
Yes.
a really personal lived experience.
They did.
About
Yeah.
losing a child, losing a family member, or someone who's still struggling with an opioid addiction. So we've been able to connect with those people, as well as Chris Auger, who did the...
Yeah, Chris was the,
Yeah, it's very, very informative and provided lots of...
he's the expert on the drugs, yeah.
So everyone is working together.
Yes.
It's a community issue that doesn't know borders. And we're glad that the health unit is working hard to help the community, and this drug strategy will take us a long ways, hopefully, into the future and stop some of the problems that we're having. So thank you very much for attending. It was very informative.
Thank you. My contact's there too if anyone wants to connect, so.
Our next delegation is Melinda Monroe, our Integrity Commissioner, and she's going to present her annual report. Welcome, Melinda.
Thank you, Madam Chair and members of council. You should have received, I hope, my very short two-page report, so I'm not going to read it out loud to you. I just want to highlight a couple of items, and then I'd be happy to take questions. The items I wish to highlight are first around in the section on education and training. You recall last year, in the context of a complaint that was being investigated, a question had been asked about whether councillors could speak to a matter where they were named as a respondent to the complaint. And my opinion at that time was yes, they could. And the Modernizing the Municipal Legislation Act, also known as Bill 68, will make that actually formal law in 2019 when those sections are proclaimed. So, thanks to the Ontario legislature for agreeing with my opinion about that. But it will now be clear that you can speak to a matter which you are named as a respondent, and you do not have to declare a conflict. You won't be able to vote on it, but you will be able to speak to it and stay in the meeting. And in relation to the Bill 68 matters, there are a number of proposed changes to the legislation with respect to what integrity commissioners can do and code of conduct contents. And so I've provided some direction or suggestions to the clerk with respect to potential amendments to your code of conduct. Also, some potential amendments with respect to issues of harassment that arose from the previous integrity commissioner and the county's lawyer. So those, I may be back to you to speak about those things. But again, we just found out the other day that the changes to the codes of conduct that are going to come as a consequence of the Bill 68 amendments are anticipated to be in March of 2019. So there's plenty of time. In fact, it'll be the next term of council when they'll actually be required law. So if there are any questions, I'm happy to answer those at this time.
Anyone have a question? Councillor Miller?
So you'll be around March 2019 for an information session, education session then?
Yes, certainly. We can have the education session any time. We can have one now on what's anticipated, so that by the time March 2019 rolls around, the amendments are in place. But certainly by March 2019, we'll definitely put some information together about what the new act will require of your code of conduct. And there also will be changes with respect to in the Municipal Conflict of Interest Act. Currently, if a complaint is made through that process, it goes directly to a court. The amendments will provide that instead of those going to court, they would come to the Integrity Commissioner, and the Integrity Commissioner at the end of investigation would then take the matter to court. It's only a judge who can rule on those matters, but it would now go through a more informal investigation process rather than going straight to court the very first day it's raised.
No one else? Okay. Thank you very much, Melinda, for
All right. Thank you.
attending. We'll move on to the adoption of the minutes. Oh, sorry.
If I could just make a motion that both of those delegations be received for information by council. Seeking a seconder.
All the delegations. Do we have a seconder? Councillor Pierce? Move that both of them be received. All in favor? Carried. Set up something in
2019.
Oh. Adoption of the minutes from the Councillor Bouma moves the minutes, seconded by, excuse me, by Councillor Coleman. Any questions or comments? I had one thing that I wanted to mention. I had a staff person talk to me about this on my way in this evening, and it's regarding the page 3 of the minutes, which is page 41 of our package, and the Fox Hill Heights subdivision. They are grinding up the old pavement today and should start the base coat tomorrow. So that is good news. Anybody else have anything regarding the minutes? If not, all in favor? Carried. Business arising from the minutes. Does anyone have any business arising? Seeing none. Consent items. 7A, there is none. 7B, items to be received. Moved by Councillor Wheat, seconded by Councillor Pierce. Anybody have any questions about those 4 items? Seeing none, all in favor? Carried. There's no committee reports. Staff reports. There's a report from our clerk regarding our new calendar for 2018. Moved by Councillor Coleman. Seconded by Councillor Bouma. Does anyone have any questions or changes? Councillor Wheat.
I'd just like to get the same day of the month, the same day. Community service for the last year to be on the first Monday, then it was on the second. Then it was on the third Monday, and 2 weeks later it was on the first Monday. So I'd like to find a consistent day and leave it there.
And I think that happened because the first Monday is often a holiday.
Excuses, excuses, excuses. That's all we need.
Yeah,
Pick
yeah.
a day and keep it there.
I think when I was on Community Services Committee, we had decided that if the first Monday was a holiday, then the meeting would be held the third Monday, I think. But you say it's been jumping around.
It isn't going to be affected by a month's
Yeah.
holiday.
Well, I would suggest, Councillor Wheat, that you should take it up with the Community Services Committee to come up with a consistent date that all the members can attend. And then let the clerk know of the change. You're welcome. Anybody else have anything they want to change? I always thought it would be a good thing to change council meeting to the third Tuesday of the month. That would give the last week of the month without any committee or standing committee meetings or council meetings. And that would give anybody around this table that wants to go on a vacation a week where they wouldn't miss an important meeting. But I don't know how everyone else thinks about that, but we used to have it like that. And then we put council on the fourth Tuesday. Councillor Coleman.
I think council meeting should remain on the fourth Tuesday of the month. It works good, it gives staff time to get the reports back and whatnot, and then the last thing I'm worried about is the invitations.
Councillor Simons.
I have a problem with that also, simply because CBC meeting is second Tuesday or second Monday, and sometimes the third Monday, and they would have a hard time getting the report back to council if it was the third Tuesday of the month. So we have to put it in the fourth. It's pretty, give staff an opportunity to get the minutes from the community, the corporate development committee.
Councillor Bouma.
Just a point of order, this is not before us. We have a motion before us with no amendments, and I think we would call the vote.
Well, the calendar is before us, and that's what we were doing, is having questions or comments on the calendar.
But the date in the calendar, Madam Chair, is already set, and so if someone would propose an amendment, we could vote on that. But I don't think we need to discuss a proposed amendment that's not before us yet. So either make an amendment and have it seconded, and we can discuss that, or we can call the vote on what's before us. That's my point of order.
I think we can have discussion before an amendment is proposed.
Well, I would
Anyway, nobody else has anything? Then we've had a mover and a seconder for the calendar as printed, with the exception that Councillor Wheat wishes to poll the Community Services Committee and look at it changing that date. And the clerk will have to adjust that at a later date if they decide to make changes. So, all in favor? Carried. And moving on, our wastewater and water rates. There's a report 9A2 from Heather Mifflin, and I see Heather is here tonight, and it was moved by Councillor Boma.
I'll second it.
Seconded by Councillor Simons. Does anybody have any questions? Councillor Simons.
Thank you, Madam Chair. I did ask Heather about the increase in the water.
Thank you.
And my second question to her was, and I didn't get an answer because it was late, will this be the 5/8 meter be the residents, which I'm thinking it is? And if it is, would this be because of the increase in housing, that we're going to be enlarging the pipes? Pipes, whatever you call those things.
I don't believe we're enlarging the pipes. 5/8 is the standard residential size.
Okay, could you please just tell me again what you said in the email to me?
Your question in the email was for the water rates, the difference between the 2017 and the proposed 2018 rate.
Okay.
That particular line that you were speaking to was for the 5/8 meter for the residential.
Okay.
Each different size has a different flat rate per month.
Okay, and why the increase of $291?
That's how it calculates out based on the inflationary costs of running the operations and increasing the transfer to reserve to do your replacements.
So we're going to be increasing
non-growth replacements.
So we're going to be increasing the reserve then, because we've used a lot of the reserve money.
Correct.
Through the year. Okay, and my follow-up question to that was, I don't know if that's why I'm asking you this, will the houses that are coming on stream be affected by is this affected by the new housing coming on stream? No?
No,
Okay.
it's not growth related, like they'll help.
Okay, that's all I want to know.
Okay.
Because I'm going to have a lot of questions about the cost increase, that's all. Thank you.
Thank you, Heather. Any more questions? Councillor Miller?
Thank you, Madam Chair. Through you to either Heather or Alex. It says in our package, the long-range financial plans project an expenditure increase for water and wastewater combined of 7.1% each year. 5.18% we've seen in 2017, 4.32% for 2018, which is obviously less than 7.1%. And the reason given is capital projects issuing of debt. And I'm just wondering, like, if we go back to the 7.1%, I mean, it's a large increase.
It is.
And it's running, well, it's a large increase no matter how you slice it, but what is the main driving factor behind that? Is it, I don't know, I know there's a lot of regulations we got to meet. I know it's an energy and intensive industry, so maybe the cost of, what's the main driver for that? Or can we put our finger on any one thing?
There is definitely inflationary costs, but there is you have to build your reserve for replacement of infrastructure. So there's a number of those projects coming up within the 5 years.
Sorry, did you say build infrastructure?
Replacing
the infrastructure.
Replace is existing.
Okay. And, okay, well, I guess if we're replacing it, then, then we need to up it so we got the reserves there. Okay, thank you.
Thank you, Heather. Moving on to 9A. Oh, I guess we have to vote on that. All in favor? There's no more questions? Opposed? Carried. 9A3, council member appointments to boards and committees. Heather has made a list.
Second.
It's been moved and seconded. There are some changes that need to be made to the list. And I wanted to go through them with the committee. The title, Councillor Coleman, for the Canesville Community Center Committee deletes the fire hall, correct? And the Municipal Elections Review Committee, Heather says it's still in session, so we haven't had a meeting for some time, but I guess we're going to. And the Paris Community Pool Building Committee, should be deleted. And moving on to page 91, the Brant County Power Transition Committee. Marietta, you and I sat on that with Councillor Booma, and that wrapped up, what, last fall, or was it in the spring? We had our last meeting.
I was there, yes. March.
Anyway, it was only good for 2 years, and Councillor Simons...
Because I was sick and it was the last meeting, it was March.
It was March, yes. So it wrapped up then, so we can remove that one. And is the Paris Farmers Market still on, Councillor Pierce?
There hasn't been one meeting that I'm aware of.
So, and they don't have one downtown like they used to, do they? So I think we could safely take that one off.
I know.
And that's all I had.
We will at the
Does anybody else have any questions about
Let's start fresh.
any of the committees or the appointments? Councillor Pierce?
Thank you, Madam Chair. So I guess what I don't see in here is that, like, the recommendation is within this? That they're the recommendation in 3? The council member appointed to the Brant County Community Health Systems Community Engagement Committee?
Oh, yes, we do need to appoint somebody for that.
So do we want to do this separate, like do these first and then do that after, or how do you want to do this?
Well, it's all one recommendation. We can separate it if you wish.
No, I just want to make sure it's not forgotten, because I got a text from Councillor Carty that he'd be interested in being on that Healthcare Systems Community Engagement Committee.
Yes, okay, and the clerk also did. So we have one person interested. Is anybody else interested in sitting on it? Councillor Simons?
I certainly am if I know what night it is.
I'm sorry?
I certainly am.
You're interested? Okay. Pardon?
Can I just make a suggestion? If we approve the motion as written with those couple of changes, then we can go forward and have that discussion. I just don't want to confuse the two.
Yeah, that's
That's why I
true.
was asking
That's
in
true.
the first place, so.
That's a good idea.
Okay, let's make the first 2 lines A and the second 2 lines B. Would that work, Heather?
Yeah,
Whatever.
Recommendation A and B. So we'll vote on recommendation A. All in favor? Carried. Recommendation B. Marietta, did you have?
You asked for people who are interested?
Yes, I did.
I am interested.
You're interested?
Yes.
Councillor Simons is interested, and Councillor Carty is interested. Since Councillor Carty isn't here, I'm not sure if we can put him on the ballot or not. What are the rules on that?
There's nothing preventing it.
Nothing preventing that? Okay, do we want to have a ballot vote for, oh, Councillor Wheat?
I move that all 3 members sit on the board.
They're only asking for 1.
We'll give them 3.
And let
I
them
don't
kick us
agree.
off. Let them kick us off.
I think we could give them 1 and an alternate if 1 can't attend. Like if Marietta wishes to attend and can't attend, Councillor Simons could go in his place. Or, I mean,
Or Councillor Carty.
we have to decide how we're going to appoint tonight.
I'll move Mayor A. Shooting the sector.
Seconded, move that Marietta be appointed, seconded by Councillor Wheat.
Councilor Simons will be the alternate if Mayor A cannot make the meeting.
Good, very
And
good.
Councillor Simons will be the alternate. That's the motion.
Involved with the hub, the medical hub. And because of being involved in that, and with the CAO, I have been also involved with the people who are operating the Brantford General Hospital and the views that are there. In fact, as recently as last week, there was a meeting, and probably the CAO will be speaking to that of what was transpired at that meeting. Thank you.
That would be good.
So Marietta is up to speed on what's happening. and that's a good thing. Thank you, Meretti, for your attendance in that regard, because it's an important topic, and the municipality should not be paying for it. So we have a mover and a seconder. Everyone knows what the motion is. I'll call the question if there's no more comments. All in favor? Opposed? Carried. Number 9A4, tax levy billing. There's a recommendation before us.
I'll move the recommendation.
Moved by Councillor Baume, seconded by Councillor Coleman. Did anyone wish the author of the report to come up and give us more information? Councillor Simon?
Thank you, Madam Chair. I think I would like an explanation of why this happened. We're talking about 9A4?
Yes.
I would like
Councillor Pierce, did you have a comment?
Yeah, I'm just trying to understand a little more information myself, so I think it would be very helpful.
Okay, thank you. And here comes the treasurer too. Good. We got two good people coming to the podium. So
through you, Madam Chair, you would have thought we planned this or something. We did anticipate that we'd have to come up and speak to this. So because it is an error that's a significant amount of money. So we've done a lot of investigating, trying to figure out how this happened to begin with, and what we've really narrowed it down to is a communication error. Through the boundary process, there was a lot of different scenarios being run. Basically, in the end, it's one number that gets input into a very complex spreadsheet that does all these calculations. We can't narrow down exactly where the communication error occurred, but from what we've been able to determine, one of the numbers used in one of the scenarios is what ended up being input into that spreadsheet. So going forward, we have come up with some new procedures and sign-offs to ensure that this is double-checked and triple-checked, even though we thought it was already double-checked and triple-checked. But so other procedures are being put in place to ensure that, there's sign-off and that this won't happen again. And I might add that this has never happened in the past before. It was an unusual year and unusual circumstances.
Any questions? Councillor Simons.
Thank you, Madam Chair. Could you explain to us exactly what the process is to correct this?
Can you use your mic, please?
Did you hear me? So, yes, I did. So going forward, we're going to have an actual physical sign-off from the treasurer to the manager of the tax department. So she's going to have a written document that has the number signed off on by the treasurer, and that she's going to keep that in her files. Then, because this does come to council for a bylaw for this same amount, so that report's going to be then rechecked by the treasurer once it's prepared by the manager. Did you have anything to add to that?
Councillor Coleman, you had a question.
It isn't going to matter if it's happened, but how long have we known about this?
We've known about it for about 4 weeks. About 4 weeks.
Anybody else have a question?
I have another one if I could.
Councillor Miller?
Thank you, Madam Chair. Through you to the authors of the report. Frustrating all around, I think, for sure. It's too bad it couldn't have been the other way and we overcharged, but
well, I don't know if
you had a
that's good
50-50. Do we know, like, the tax rate or the tax increase? What was it? What did we set it at, and what would this have put it at if we had known? Were you able to crunch those numbers, Heather?
We did look at that. It was 1%.
Yeah.
It was around 1%.
We come in at 3, I think, and it probably would have put it at 4.
Roughly.
All right. Okay.
So they were under tax, right? So the
No, I know,
taxpayers
that's
have
what I'm
only
saying. It would have
paid
been even
like
higher.
2 point something.
Okay. Thank you.
The $870,000, is that approximately 2% on the tax bill?
No.
Like,
I don't have my
it used to be 1% was 400,000 approximately.
So it's about, would be about 2%. The budget was passed at the right amount, so.
To the chair.
The budget was passed at the correct amount. It was the bills that went out to the taxpayers were under, yeah.
Anybody, Councillor Simon?
Thank you, Madam Chair. So it says, as a result, staff recommends that the deficit be funded by other sources. Now, what do you mean by other sources? Do you know that yet?
We anticipate that there's going to be,
I don't want to hear this.
there's going to be a surplus in the budget numbers this year, which would fund part of it.
Part of it.
Part of it. So we don't know exactly what the surplus is going to be, for one thing. And then once we do know that, there is some other options. We do have some contingency reserves that could potentially fund the rest of it. But what we thought is, once we know that final number, that we would bring it back to council for their approval on how we would fund that.
Okay. Anyone else? Moretti?
Hopefully, there will be a surplus, as there has been in every previous year, and mostly more than we expect. If the worst scenario were to take place, would it be possible to use the asset management reserve in any way?
That's a good question for you.
I'll leave that with you.
Yeah, we do have
I don't think
the
it is,
contingency
but there
reserve.
should be, a municipality, I feel, should have the option in a situation like this, which is one of a kind, you know. You should be able to, but,
Well, we can bring back various options.
thank you.
Okay.
So,
Good. And that was going to be my question, when you mentioned we would use the surplus and we have reserves. I was going to ask what reserves, but.
How much is in the contingency?
I think it's over $1 million.
So we do have a contingency reserve that has over $1 million in it.
Yes, that's true, too. Do you know how much is in there?
It's over $1 million. I don't know the exact number.
Oh, really? Oh, that
But
makes me feel
1.2.
better. Thank you.
Thank you.
If everyone's had a chance, thank you very much.
Okay.
Okay, we've got a report with a recommendation. It was moved and seconded. All in favor? Carried. Our next report is 9B1. No. Oh, I'm sorry. I missed our general manager's update. Robin?
So again, through you, Madam Chair, just thought I'd give you an update on Bill 148, since that's contentious with the issue with the firefighters' on-call pay. It passed first reading on June 1st, second reading on June 18th, where it was referred back to the Standing Committee. So since then, there's been 3 meetings of the Standing Committee, and then there's another one scheduled for Thursday of this week. So we anticipate at any time this could get sent forward for final reading. In those 3 meetings that have happened already, they've had back-to-back delegations come and speak to the various aspects of the bill that are in opposition. So we're hopeful that the committee is listening. AMO did present their viewpoint on the firefighter position on October 31st, so we know that that has been presented. I also wanted to update you on the Ranch Road closure. I had indicated at the last meeting we'd bring a report to this meeting, which we had fully intended to do. But there has been some issues arise, and we are actually getting a legal opinion at this point. So once we have that legal opinion, we will bring a report to the next CDC meeting. And lastly, we have your budget binders here. It's a good news item, so we'll make sure you have those before you leave tonight.
Okay, thank you very much, Robin. Any questions? Moretti?
You spoke to the cost of firefighting. I'd like to ask about the cost of policing. Now, everyone is overjoyed the fact that the total cost of policing is down. Well, it should be down because, as we know, we were overbilled. We were one of the municipalities that was very heavily billed for a number of years, and then it was decided that yes, that was true, and we were to come down. But what I'd like to point out, and the expositor reporter did, that the actual cost per building, per residence, per factory is up this year, which will carry on year after year after year. And where the shortfall comes, in my opinion, is the number of buildings that were transferred in the boundary means there'd be considerably less income along with an increase per. So to just say, oh, it's wonderful that it's down, well, there are factors that have entered into that. That's all I'm saying.
Can I respond to that?
I know you know that and have figures. Thank you.
I think the article in the Expositor, the one that I was quoted in anyway, it said that one of the reasons that the cost was down was because of the smaller boundary area. It didn't point out that there was two other factors, or there was one other factor that contributed to it as well, which were prior year adjustments that brought the cost down. Going forward, we won't have, well, we don't know if we'll have any prior year adjustments, but the cost will go up after this year.
Thank you. That's the fact.
And also, there was properties that were taken off of the roll that were counted in the billing model. Properties such as solar facilities.
Billboards, I think.
Pardon?
Billboards. There was different property types taken out of the property count.
Yes, they were all listed.
Yeah.
And they were removed, so that brought our bill down. I don't know how many properties exactly in Brant were taken off because they met the criteria. But I think you probably explained that to the expositor, and so did I, but they only print what they want to. So thank you very much, Robin.
They were actually taken off because they should never, it was agreed they should never have been on.
That's correct.
Thank you.
Thank you, Madam Chair. And I don't know whether this is to you, Robin, or if it's to you, Councillor Gatward, that you could take back to Police Services Board. It seems to me there's a lot of changes happening with our County of Brant, OPP, and it seems to be happening on a regular basis. And I don't understand, does this happen in every community that has OPP?
Are you talking about staff changes?
Yeah, like huge staff changes, and it just seems that every about 6 months, things just change huge.
Part of the problem with the OPP is they have a huge number of retirements occurring and coming up, so they're in a huge recruiting cycle right now. So they're having to pull people from all over to cover
Different areas.
in different areas, yeah.
It's very
And we do get a report every month on staffing, and in October, our detachment was at full complement for the number of officers that we need. But there are retirements, and there are transfers, and there are a variety of staffing changes. For those that don't know, right now Inspector Liptrot is on a special assignment for 6 months, and Staff Sergeant Jim Milson is replacing him for the 6-month period. And that's just another example of the type of thing that happens within our detachment. The Police Services Board has no control over staffing. That's an operational matter, which we have nothing to do with. So if there's no more questions of Robin, thank you very much. And we'll move on to 9B1. Operations, and there's a report, review and provision of water infrastructure and a recommendation from our water manager, Alex Davidson.
So moved.
Moved by Councillor Boma, seconded by Councillor Coleman. Does anybody have any questions of Alex? He's here. If anybody wants to speak to the report, Councillor Baumann.
On a somewhat related matter, if Alex could just refresh my memory, our water bills are entirely based on cost recovery basis. Right, Alex? Simply yes or no. Thank you.
Yeah. That was easy. Thank you, Councillor Baumann. Anybody else? Well, thank you for the good work you do, Alex, and I'll call the question if there's nothing else. All in favor? Carried. Our next is the General Manager's report, and Mr. Bradley is at the podium.
Thank you, Madam Chair. I have a General Manager's report tomorrow at Public Works and one last week at Community Services. So just a few items that fall outside of those two meetings. The Adidas solar project is ongoing. I think it's at this point about half done. And actually we have, Adidas flew it with a drone the other day, and I will try to get those pictures out because they're pretty good. I don't have them at this point. They're just getting formatted. So there's a solar project also scheduled for the Scotland Community Center. It hasn't started yet. We do have electrical upgrades that were part of that project, and they'll be starting later this month, and then the panels go up. It's a fairly small project, and so we actually are anticipating at this point that it'll be done before the end of the year. We have until April to get it done with our FIT contract. A couple of EAs with public meetings coming up before our next meeting of the Corporate Development Committee. The St. George Water and Wastewater Servicing EA, this would be public meeting number 3, and what we assume at this point would be the last public meeting before that EA is completed. It is next Tuesday, November 21st at the South Dumfries Community Center. It starts at 6 p.m. We're not going to do a presentation on that one. It's mostly developers that we've had come out, so it'll be just the normal public meeting format.
Normal?
A Grand River Street North corridor EA. Its public meeting is on December 7th at 6 p.m. at the Paris Fairgrounds, and we will be having a presentation by the consultant IBI, and followed by the mix and mingle type of public meeting. So it's my report, Madam Chair.
Thank you, Mr. Bradley. December 7th at what time?
6 p.m.
6
at the
p.m.
fairgrounds.
Any questions? Councillor Simons.
Thank you, Madam Chair. I have a question regarding the Community Services and Works Department presentation that you make. Are those, the information pieces that you give those committees, are they included in the minutes? Because we that don't go to those meetings don't get those updates. So I just wanted to know if they were included in the minutes.
Madam Chair, they are included in the minutes.
Okay, thank you.
Councillor Miller?
Just a comment and a question. The Scotland Community Center, I don't know if we have a few people very vocal, or just, but there seems to be a lot of people quite happy with what was done there. I've gotten a lot of feedback on that. So kudos to you and your department for doing that. Question for you is, different topic, the transit needs analysis. When do you think we will see that?
Yeah, Madam Chair, at this point we're looking at January CDC. We think it'll be done by December, but we're not fully confident in that. And so I talked to the consultant, Leslie and I talked to the consultant last week, and we're just, to be on the safe side, going to bring it to January CDC. It gives us a little more time to make sure that all of our I's are dotted and T's are crossed. So.
Any other questions? I just wanted to mention I think that the public in general is happy with our rollout of weekly recycling. It started November 1st, and I've had positive comments about that, and no phone calls to say my recycling didn't get picked up. I don't know if anybody else did, but that's great that we're rolling, and it seems to be going smoothly.
Madam Chair, I happily put my one box of recycling out this morning. I was quite happy to do that. So.
Thank you. Okay, moving on then to Development Services. General Manager's update. Here, Mr. Pomponi.
Just two things since last week. As I had advised Council, Doug Lyons was starting today, in development engineering. Him and Don Cunningham have gone out and done a tour of a couple of the subdivisions that are being worked on. One of them, out at Fox Hill. It seems that Doug is quite familiar with the contractors, and so we're expecting that with his knowledge and background, because he's got a lot of years with contract work, working for municipalities, so we're expecting the transition period for him getting up to speed is going to be pretty quick. So, which will lead me into my second update, which Councillor Gatward spoke of earlier. Fox Hill subdivision, they're beginning to do the work. The first part of it is milling out the base to get down to a base that they can put the next base coat on top of. They're finding some issues with the gravel base that was underneath of it. However, that's going to be corrected by the Cocoa paving contractors. They're going to come out, correct the base, the elevations of it, and then lay the first coat. If they have to do it on a weekend, they're going to be doing it on a weekend. They've certainly laid asphalt in the past on weekends, and they're committed to doing it. If they can get, and again, they have said again to us that if they can get top coat done this year, they will do it. It's all dependent upon temperature. So, and the other thing that we just found out today is that the engineering crew has been on site to do some grading work, shoot some of the grades, so the grading certificates will come back. We're expecting the final ones to come in, so it's looking good.
Any questions? Is that everything?
That's everything, yes.
Thank you very much for that Fox Hill report. That was more than I got. So that's good news that we're finally moving forward on that. The residents have been patient for a lot of years. Seeing nothing else there for development services, economic development and strategic investments. Allison, there's a report and there's a recommendation.
So moved.
Who said that? Oh, Councillor Pierce moves. Councillor Coleman seconds. Allison, do you want to come up? Is there any questions of Allison regarding her report? Councillor Pierce.
Thank you. If I could just very quickly, I think the logo's great. I'm just curious, was this, you know, was it boom just the one, or was there some close, or how many, like it kind of alludes that there was a few here, but I'm just wondering.
Through you, Madam Chair, there were 3 options that were presented to corporate communications with the idea that there was consistency with the corporate brand. It was easily identifiable, and that they were used in conjunction with one another to keep, again, the consistency going forward. This was the one that was approved through corporate communications as the recommended logo to be used that they felt was most consistent with the existing County of Brant logo.
Perfect. I love it.
Rather than the County of Brant logo, is that what you?
With.
No, they were used in conjunction with one another.
In conjunction. Okay. So that other black and orange stuff is gone?
Yes.
Thank you.
Yes.
Thank you.
Prosper and Brant? Yes.
Good.
Thank you.
Councillor Powell.
I'm not a graphic artist, people, but invest in Brant, I'm okay with that. I don't see what the 2 pale colored blobs have to do with business and if it was business, you would think the higher one maybe would be on the right because you're going upwards, but I don't see the tie in between business and investing in Brant with those 2 symbols.
We'll let Allison explain that.
I'll preface this with a caveat that I'm not a designer either, but the rationale is sort of listed below the logo. That logo is meant to mimic a small B for the County of Brant, which is why the positioning of the 2 towers, using the same color palette again as the existing county logo, and to speak to the towers being growth within the county.
Not to complain, but still a stretch for me to think, when I look at that, that's a B, and it has to do with business and moving forwards. I would have thought there's a lot better ways to display business, and you're on the upbeat, on the rise than that, but that's just me.
Anybody else want to speak to this report, or?
Thank you.
Artistic
Thank you.
design. Seeing nobody else, then, thank you for that. Now, Allison has a recommendation for us. And has it been moved? It's been moved and seconded. I'll call the vote. All in favor? Carried. And we'll move on to your report.
Thank you, Madam Chair. Just a couple of updates. We have the CAO planning staff and myself have met with the province regarding the redesignation of employment lands. This is a sort of process that's going in conjunction with the employment land strategy that I've spoken to before, and I just wanted to let you know that those talks have continued, and while we won't have definitive answers for probably a couple of months, perhaps longer than that, the meetings that we've had with the province has been very positive, and I think the indication that we got was to continue and to keep them posted and to work closely with them going forward. So it was very encouraging from my standpoint. So just to let you know that that is happening in the background, and once they have their criteria in place, which we're told will be before the end of the year, we should be able to move forward quite aggressively with getting those redesignations in place.
Are you finished, or did you want to take questions on that?
Either one, I'm happy to take questions.
Councillor Simon.
Thank you. Through you, Madam Chair. My question is this, and I don't know if you can answer this or not at this point, but there could be possibilities of a new government next year in June. And if that's, you said this would be probably approved in April or the spring. If that happens, could the new government take this away? Or would it be something that would be strategically good for both governments and just left in place? Like, if you've got any input on that whatsoever?
Through you, Madam Chair, this isn't something that's new being proposed. The criteria is what's new. So I don't see this necessarily being something that's going to be strategic in that it's going to be taken away or changed by a new government. Like I said, it's not a new policy per se. It's just the criteria surrounding that policy and how that's applied to different municipalities for consistency. That right.
And were you finished your report, or did you?
I just have a couple more
Yes, Allison has more. Go ahead.
Okay. And an update on our move to Wincy Mill. It hasn't happened yet. We did take tenancy last Wednesday. There were some delays with the getting the trades in to finish the space, and we're now just waiting for our furniture. So I would expect that will be in the next week or two, but I will keep everybody up to date of when the department actually moves physically over to that space. And some good news, the video that we had, the promotional video that we did and was unveiled at Salute to Brant, won a Platinum Marcom award. This is through the Association of Marketing and Communications Professionals. So we're really pleased with that, and once the award is actually physically here in our hands, we will be presenting it to council.
Yeah, that was very, very good. I mean, I couldn't believe there was thousands of entries, and Brant County won. That's great.
Yeah, there was over 1,000 and from over 100 countries, so we were really happy with that.
And when you move across, you'll have all the same telephone numbers and extensions?
Yes, nothing will change in that regard.
Great, thank you. Any other questions of Allison? Seeing none, thank you very much, Allison. And we'll move along to communications. And I see none. Matters referred by council. I see none. Other business. Does anybody have any other business? I just want to mention that I had the privilege and honor of laying the wreath on Saturday for the Remembrance Day service in Brantford, and it was a very good service. And the planes flew over right when Mayor Friel and I were laying our wreaths, so that was exciting. And only my toes got cold, so thank you. No other business? CAO's update.
Thank you, Madam Chair. Just a couple things here. Shared Services Committee met, some of you are on it, last week, and we moving forward two things and two items, the Transportation Master Plan and the Emergency Services Coordinator position. So good progress there, and there were some other things then that were added to a list that are going to come forward to council for your consideration, and if you want that committee to tackle those, we'll deal with those. So making progress there. You know, there's a special meeting this relating to shared services of the ambulance, of the Community Services Committee, the portion that has the mayor and one of the councillors from the city of Brantford there to deal with more detail around the proposed ambulance budget and the reasons for it, and that kind of thing. So that's coming up. There was a facilitated session, the second in a series with Michael Bryant, appointed by the Premier to talk about facilitating a few things between Six Nations, the City of Brantford, and the County of Brant. The Mayor and I attended that, I think it was a week and a half ago now, down at Six Nations this time, and a few items were discussed. It's my understanding that the city will be dealing with these in camera at council tomorrow night, and if you want me to update you, I think I'd have to do it in camera because we've been asked by the facilitator to keep things confidential. Would you agree, Mr. Mayor, with that? Okay. And out of that, though, or happening out of the boundary agreement, actually, the joint ventures with Six Nations, the City of Brantford, and ourselves. We had another meeting this morning. Michael and I and Allison were in attendance, and there's good progress being made there. We have a draft of an accord that we're proposing to bring forward to all three of the councils independently in December. So, and if you're happy with that, we would move forward to the next step. So we're making some progress in that regard. And the mayor asked me to comment on meetings with the supervisor and the interim CEO of the Brant Community Healthcare System. They contacted us and wanted to get together. That was about, again, a week and a half or so ago. And there had been a flurry of discussion and activity and thoughts that something was going to happen with the Willet as far as it being reopened again, or portions of it reopened. And they sat down to tell us that, well, that's not true. The Ministry of Health has been looking, is anticipating a tough flu season, and has been looking around the province for additional bed space and have put some money aside, and they're just looking. And somebody had suggested, well, maybe the second floor of the Willet might be a space that might be available for that. And he said, well, we're looking at things like that, and we would, if we think it's appropriate, we'd have to put a bid in or to the Ministry of Health, and they'd weigh that with all the other requests. So it was very much put down the excitement that was sort of flirting and buzzing around for the last 48 hours before that. And one other thing, yes, there's been some suggestions in some quarters. It was brought up at the Economic Development Advisory Committee that maybe it's time for us to update our strategic plan. And we have a strategic plan, as you know, that's been in place, and I think serving us well for the last 4 years. That's a yellow sheet in front of you. Because I had indicated to the people that have asked that I'd bring it up with council. You'll have to decide. We could put money aside in this year's budget and do something next year, but in the next year's election year, you might consider, it's up to you, that it might be more appropriate for a new council to embark on a strategic planning process. But I raise it with you and give it some thought, and we can discuss it during budget process if you'd like. So that's all I have, Madam Chair.
Thank you very much. CAO Emerson, and we'll have questions. Start with Councillor Wheat.
Not a question, just further to what Paul said about meeting the Six Nations. Robert Chambers and I are the group that represents the county in negotiations, and Robert and I are meeting with Lonnie Bonberry and Phil Montour this Saturday.
As part of the liaison committee?
As part of the liaison committee, Councillor Chambers and Councillor Reed, we just approved it, that Chambers and I would be there again. And we're meeting with 2 representatives of Six Nations like we regularly do. We're meeting again this Saturday, just to inform you.
Thank you for that, Councillor Wheat. Will there be others from the county, such as Mayor Eddy or Mr. Emerson, attending that meeting?
I haven't asked either one of them to do it. I think Robert and I can handle it.
And will there be minutes from that meeting?
No.
Okay.
There never has been.
And is it only Mr. Bonberry and Montour that attend?
Usually, yes.
So the 4 of you, but there's no minutes taken?
No. Never has been.
Okay, I think that's unusual. Normally,
You approved this 3 years ago, that Chambers and I would be the representative for the liaison committee, and we try to meet with representatives from the Six Nations regularly, and then we have. So I'm just letting you know that we're going to meet again
perfect.
this Saturday.
Will you report back to council
If
then?
you have questions, I will. I never have brought a report back. It's always been an amicable meeting. We let them know what they're doing, and they let us know what they're doing. Everything seems to be fine.
Good, I'm glad to hear that. And it would be nice for councillors to know what they're reporting on and what we've reported on. Thank you, Councillor Wheat.
We have a debate as to who's going to pay for the bill, because we're meeting in a restaurant.
Okay. Any other questions regarding, or comments regarding the CAO's update? I have a question, if I might. You mentioned that our joint ventures that we had included in our boundary agreement. There was a meeting between yourself and the city and Six Nations?
Yes.
With Mayor Eddy? No?
No, I think I've reported on this before. We've met, this will be the 3rd or 4th meeting. It's a staff level discussion.
Okay.
There's been Michael and I, and Allison, you sat in on this meeting. And Mark, I don't know whether you had attended one of them, but at any rate, at the staff level, with our counterparts from the city and Six Nations.
I see.
And we've been working through how this could look, but.
And you've drafted an
We've
accord.
drafted an accord that we, I believe at a staff level, everybody's comfortable with it. There was some fine tuning today. And then we're hoping to bring that back to our respective councils in December.
And does it refer to working at the airport and Cairnsville areas?
Yes.
Yeah, okay. Oh, wait.
Yeah, but that's what it's about. It's exactly what was coming out of the boundary.
And when is the special meeting for community services and the ambulance budget?
Is it on Monday? This coming Monday.
At what time?
11 o'clock.
11 o'clock?
Yes.
Here?
Yes, it's right here. Yeah.
Thank you. If there's no other questions for CAO Emerson, we have a motion, Councillor Coleman, seconded by Councillor Pierce, that we move in camera to discuss a personal matter about identifiable individuals, labor relations, employee negotiations matters, and proposed acquisition of land by the municipality. All in favor? Carried. We're now.
This one is open, citizen appointments.
Oh, okay.
So, citizen appointments.
We're in open session now, and 14A, we have a motion for the citizens' appointment moved by Councillor Coleman, seconded by Councillor Simons. All in favor? Carried. Anything else? That was the only one that was coming out in camera. Oh, there's the next meeting's December 11th. Meeting's adjourned.